Hello, my name is Dr. James R. Golding, and you're watching A Natural Healthcare Alternative, the program dedicated to your health, longevity, and well-being. Don't dream of moving the channels either north or south today, because the real news is right here. The topic for tonight's program is going to be on allergies and allergy elimination using an all-natural technique known as N.A.E.T. People are suffering from allergies and allergic responses at a greater rate today than at any given time in history. Allergies can be either in the form of airborne allergies due to particulate matter in the air, such as pollen, ragweed, seasonal allergies types of things, dust mites, things like that. It can be food allergies, meaning your body's inability to digest certain foods, and then these foods turns into a toxic response in the body. It can also be to toxic accumulation of foreign material in your body that reaches a critical mass to the point in which you develop allergic response. Now, we all know the symptoms associated with allergies, such as runny nose, watery eyes, hives, skin, itching, irritation, digestive disorders, a whole host of symptoms known to be associated with allergies and allergic responses. Initially in the body, an allergic response is your body's defense mechanism. It's part of what it needs to do to combat a foreign material. What happens, however, is that many times we have an onslaught of this foreign material that overwhelms your body's ability and your body's immune ability to overcome this foreign material. We all have autoimmune responses that start and build with us on a daily basis, and things that carry over throughout the course of a lifetime. That's one reason why we attempt to get immunization shots to build up an immune response to either bacteria, foreign-related matters, viruses, things of the sort. Modern medicine's attempt to combat this disorder is using blood tests or skin irritation tests to try to isolate what exactly a person is allergic to. From there, they usually try to get serums that a person can be injected with, or rotational diets, or if you're lactose intolerant, don't have any dairy products in your diet. So we try to isolate the causation and then medically try to build up this autoimmune response. What's not commonly known, however, is that there is an all-natural technique that can create this autoimmune response in your body to actually have you eliminate the things that you were allergic to before. I have a special guest on the program today. His name is Dr. David Kuchman. He's from Shrewsbury, New Jersey. Dr. Kuchman has a parallel practice to my own in the fact that he practices acupuncture, chiropractic care. He was originally, and has been in practice for 25 years. Originally, he was in Little Silver, New Jersey, and now he has a large office of alternative medicine located in Shrewsbury, New Jersey, that takes care of many different facets of alternative medicine. He's going to be demonstrating this technique today because he's a master at it. And it's a combination of acupuncture and utilizing chiropractic means in concert and combination to eliminate these allergies. I'd like to now introduce to you Dr. David Kuchman. Welcome to the show. It's terrific to have you here today and working with you.
Thanks for having me.
Can you tell me a little bit about how this technique was developed?
Dr. Nan Boudreauxpad, she's a chiropractor, acupuncturist, medical doctor, applied kinesiologist, an RN, and an Oriental medical doctor. So she's been spending a lot of time studying techniques to try to eliminate her own allergies. Back in 1983, this is when she discovered this technique. She synthesized the techniques of chiropractic, acupuncture, and nutrition to evolve an ability to eliminate the reaction people have when they're exposed to an allergen. She found that it's a bioenergetic reaction that the body has. It's not much different than when you walk into a room and there's somebody there that you don't like and you don't know why. It's like your energy and their energy does not mix. It's like oil and water. So when you're exposed to an allergen, and she finds that food allergens are the most important to start with. She has a very specific sequence that she utilizes to be able to eliminate the way the body reacts. So she likes to build up the body's ability to absorb food first before you take on something like an environmental allergy like dust or pollen or a chemical like pollution or smog. And she will discover what you're reactive to by utilizing a very unconventional way of testing. She'll do a muscle response test. So she'll take an allergen, which is a mother tincture, so it comes in a glass vial, so that it eliminates the severity of a possible anaphylaxis reaction. So she'll hold onto the glass vial, the patient that you're testing, but in her case, she treated herself. And she would place that glass vial in your hand and then muscle test to see if there was a reaction. So a previously strong muscle would go weak when you're allergic to an allergen. And so this is how we would determine which allergens to treat.
Now this is then applied kinesiology? Is that using, you know, the technique of applied kinesiology for that component of the analysis?
The applied kinesiology would be the muscle testing component, and that's how we would utilize that particular technique to find out what a patient is allergic to. There are also organic reflexes on the body that are related to various meridians and organs, and so when there is an organ that is a target organ that is reactive to the allergen, see, this is what's really unique about this technique, is that you could find what organs are being reactive. And depending on what organs are reactive, depend on how the patient will react symptomatically. Right?
Now, are these organs literally in its literal context, or organs in relationship to Chinese medicine and the meridian function of energetics in the body?
It's more on the bioenergetics and the reaction that the organs will have when the energy is blocked to it. For instance, if the energy to the large intestine meridian or the lung meridian is affected, it's blocked, then the patient, when is exposed to, for instance, dairy, cow's milk, then the patient may develop skin problems, or they may develop a runny nose, or they may develop intestinal disorders like gas, diarrhea, what have you. And by utilizing this technique, you can eliminate the reaction that the body has when it's exposed, because it takes an incompatible allergen and makes it compatible again, so that the body does not have that reaction.
And is that by normalizing the flow or blockage that may be in that meridian, or is it actually on a biochemical basis where it's changing their autoimmune response to that foreign matter?
It does that indirectly, but the treatment bases more on acupuncture physiology. There's a back treatment called spinal set 1 and spinal set 2, where we do a percussive technique, almost like an acupressure on the Watto points that are a ½ inch away from the spinous, and then also on the shoe points, which are 1.5 inches away from the spinous process along the spine. And we percuss these while the patient is holding the allergen. So what we're telling the body is that this allergen that is incompatible now is going to be compatible, and it's not going to disturb the energetics of the body, blocking the meridians, thus evolving into some type of symptomatology.
So it's almost like a classical conditioning on a physiological level. What was once bad or perceived as bad can be overcome, or can not be bad, or responded to in a bad way.
It could be eliminated. That's what's the beauty about this technique, is that you don't treat a symptom with a medication or trying to mask a symptom. What you're actually doing is taking the body and adapting it to the allergen so that it can be able to not react in a negative way. So it actually eliminates the reaction.
Well, this is exciting. Now,
It
before
is.
we do the demonstration today, walk us through some of the upstart procedures. Let's say somebody's, suffered from chronic allergies, food allergies, and they've done a myriad of things, and it's just not working for them, or it hasn't resolved to their liking, their condition. They make an appointment in the office. Now, so is there like specific questionnaires that help for you to, as a screening tool, to help to focus that? Give us a quick run through up until that point.
Okay, a rundown, step by step, blow by blow, is that yes, a patient will fill out a case history so that we know what they're interested in trying to eliminate. So that, they usually, a patient will come in with some specific problem that they want to have eliminated.
Okay. So most people kind of know what they're there for and what type of allergy they have.
That's the kind of patient that we'll see the most frequently in practice. Although we will see patients come in who are healthy that just want to have a higher level of optimal function. So a healthy person can benefit because it will just eliminate any reaction that may be keeping them from expressing their full potential.
Mm-hmm. Do you discover allergies that a person was unaware of before? I mean, is that a frequent occurrence?
You can find allergies that they are unaware of, but usually the basic allergies that you're going to find with a patient is going to be they're allergic to things that they usually like, especially in the food categories.
Isn't that the damned in life? It's always the things that we like that seems to be what seems to do us the most harm.
Yeah, and that's the truth. I mean, if you like ice cream, it's going to be ice cream. If you like tomatoes, it's going to be tomatoes. If you like pizza, it's going to be pizza. It's always what the patient eats on a regular basis. And the effects of clearing these reactions have a long list of problems that can be eliminated, including emotional problems for children, hyperactivity, attention deficit disorders. It helps to bring them back to earth so that they can focus again.
Yeah, now, can this technique be expanded into a big issue in my practice nowadays is children and the increase of childhood asthma. Seems to be happening to a larger extent now than ever. I've been treating it using clinical nutrition and chiropractic care and direct, symptomatic treatment with using acupuncture and trying to boost up their immune response. Now, is this technique transposable to asthmatic response?
Asthma does respond to eliminating the reaction you have because you're unblocking the meridians that affect the lungs and the bronchioles so that they'll be able to get more air in, so that when they're exposed to an allergen either being ingested or inhaled, they're not going to have that physiological reaction.
The diminished function.
The diminished function, so they'll be able to breathe better. And Dr. Nambujapad had found that allergies are on 3 different levels. Physical level, and the physical level is what responds best to chiropractic, because chiropractic has been known to help allergies, but it's on the physical level. That's by restoring the nerve response to the organs. There's also a nutritional level, and then the most important is the emotional level. The emotional level is usually during times of stress that the body is the most susceptible to becoming allergic. So if somebody goes through a loss, they go through grief, they go through anger, they go through sadness, these are times that their body can be susceptible because the meridians are related to various emotional components. So when they are in emotional state, that's when those meridians become susceptible to becoming blocked when they're exposed to an allergen.
There's a lot of intercorrelations, interreactions within the body. I mean, it's just these, it's an amazing dynamic that goes on.
It is.
Is there anything that you want to add at this point before we shift into our analysis demonstration phase?
Okay, so what we're going to do is we're going to demonstrate how we would test an allergy, how we would treat an allergy. Now, the very first allergen that we always treat is called the BBF, which is a brain-body balancing formula. This is an enhancer. It's not an allergen, but it is something that Dr. Nambujapad has created through homeopathy to be able to help the body, to connect the brain to the body, so when it's exposed to an allergy, the clearing is more effective. So that's what we're going to demonstrate today. Now, there's some setups that we do. There's something called a permission test. It's a test to see if the patient has enough energy to be able to clear an allergen. Because if the body is compromised in any way, allergies will not be eliminated as effectively.
Okay, so it would almost be a waste of treatment until you get their resources up to a healing level?
That's right. You want to make sure that the body is energetic enough to be able to eliminate the response. And that's why she has a very specific sequence. She calls it the 15 basics, and which would be food items like eggs, vitamin C, sugar, mineral mix, grains, and thus so forth.
Okay, and so that would be always addressed initially, you know, in the sequence, no matter what. That it's going to work from the top down with that.
Not necessarily treat it, but at least test it for any reaction. Because by clearing the basics, many times what happens is that the allergies that they come in for, be it pollen or mold, they will eliminate by making the body stronger. So the body will heal itself, so to speak, by clearing the basics first. Okay, so the first thing that we do is we test the allergen. So we do this by lying on your back. Okay, and we place this in the hand. You close your fingers around and the arm goes at the side. The arm on the opposite side, palm out, thumb down, the lung meridian towards the liver meridian, and press back. We look to see if there's a weakening reaction. So we're going to try it just without it. Just make sure the muscle is strong. Ready? Good. Muscle is strong initially. When we place the allergen in the palm, we lose strength. That's the way we could tell the body is reactive. There's a hand mode called permission test. This is overcharged, undercharged meridians. Press back. This is make sure that we can treat the patient today, which is the appropriate test. Yin-yang balance, right? Organ reflexes. And we got gallbladder and spleen.
Now, weaknesses of that muscle response in relationship to those key points or moo points on the organs, they're going to create a weakening of that muscle response?
If that meridian is imbalanced, it will be weak upon muscle testing when exposed to the allergen. And then we stimulate it by doing a tonification massage, which is going to be clockwise. Okay, so what we are going to do now is we're going to have the patient lie on their stomach. So you lie on your stomach. There we go. And we have the patient hold the allergen to their forehead with an open palm. And then the opposite hand, they do the hand mode for emotional. And we have the thumb and the ring pads together. And then we're going to use the arthrostim to stimulate the Watto points first. Take a breath in. It's called breathing technique. Breathe in, hold your breath, blow out your air, and hold your air out. Now you're going to bring fast like a pant. All right? And breathe normally now.
And that is a percussive machine?
It's a percussive device called the arthrostim. Now we're doing the shoe points. And the patient breathes normally at this time. Okay, now we have you lie back onto your back. And the palm goes up, hand closed on the allergen, palm out, muscle test. At this time, we should see a change in the muscle strength because there's spinal set 1, spinal set 2, percussion along the spinuses and along the shoe points should adapt the body so that it's not reactive to the allergen.
Okay.
So this patient is strong. We recheck the reflexes, and we're going to re-stimulate the spleen circuit. That was the only one that came back. And so at this time, what we do is acupuncture on the what Dr. Nambuja calls the 8 gates. We're going to do large intestine 4, heart 7, large intestine 11, spleen 6, and liver 3.
Now, is this the core treatment for everyone initiating this this sequence of treatment as far as when they first come in?
This is the treatment while you're exposed to the allergen. The organ reflexes can vary to the patient. There are also, the brain can also, there's a brain treatment. You often see this when people who have a reaction to the nervous system, and you'll see this oftentimes with children with hyperactivity and attention deficit disorders. And so there's a specific treatment where we stimulate the scalp. But we're going to be using the NAET gates today.
Okay, let's see.
Okay, so let's
keep in mind all needles that are used are single-use disposable sterile needles. The areas are swabbed to make sure that everything is clean prior to the application of the acupuncture needling process. Different areas of the body require different depths of needle insertion and different stimulation. And he is doing an approach that uses predominantly the points from the knees down, from the elbows down, and up into the head and facial region. Sometimes he'll incorporate auricular medicine, which is the use of ear acupuncture points.
And there will be 8 points that we're going to needle, and the needles are left in for 15 to 20 minutes.
Okay. Is that the average length of each treatment as they go along, or?
Yes.
Okay.
Yes, that will be.
So does it take much longer on the initial visit than subsequent visits? Because from my understanding of what you're saying, there's continuous testing as they go along with the treatment sequence.
Yes. So what will happen is after the acupuncture has been done, we pull the needles out and then we retest the patient to see if there's any additional treatment, if we have to retreat spinal set 1, spinal set 2, using a percussor along the spine. Sometimes there will be a combination allergy, and this way, for instance, cow's milk may be combined with coffee, if that's the way they utilize it. So there may be a combination allergy. So right now we're doing the brain-body balancing formula. It's an enhancer. It's the very first allergen. If it's weak on the patient, we start that.
How's that feel, Don? Is that comfortable with the needling process? Not painful or anything, right?
Most patients.
Oh, sorry.
Go ahead. I'm sorry.
Yeah, characteristically, a lot of patients, what they'll sense initially with this, some acupuncture points are relatively neutral and not painful or tender to the needling process. Some points that really need to be needled are reactive and tender to the process because they just really need to be needled and treated. So they'll only be tender upon insertion. Frequently, it'll turn into like a dull ache, and then the patient will feel very, very tranquil. As that tranquility occurs is when we get the balancing process of the meridians, meaning the channels within the body. We get the underlying immune response going on as far as the changes that occur chemically with the process itself.
Now, oftentimes while the patient is holding the allergen, they can feel like a warmth or numbness in their palm when they're holding that in their hand. The hands have many nerve endings. They can feel temperatures, hot, cold, vibration, smooth, roughness, and so it can perceive the allergen. And that allergen can have a reaction and the patient can sense that.
So there's a reactivity, that there's a correlation going on between what's going on within their own system and then the effect of the allergen with the treatment simultaneously. Yes,
yes. But that will pass, the reaction that the patient has when they're holding it. Usually over the course of the 15-20 minutes that they hold the vial, the sensation will go. And the patient will have a sense of well-being afterwards.
Mm-hmm.
But then there's an abstinence when you have an allergy reaction. There's, unlike traditional, like you have to avoid an allergy that that you're
no
physically,
bagels, no
no bagels, no milk. In this case, it's after the treatment there is only a 25-hour avoidance period. this period with the acupuncture needles, and we could do this also for children without acupuncture. We do acupressure utilizing a stimulator that has a magnetic tip and it vibrates. And so it's a very painless technique, and
for those that are needle shy.
Needle shy, and mainly like for children, because we take care of a lot of children in our practice. And acupuncture, though, seems to work a little bit deeper and a little bit more effective, less retreatments on a specific item, because sometimes an item may need more than one treatment, especially if they're a more serious reaction, like an anaphylaxis. Those kind of allergens need to be treated usually more than once, and they're not the first one you treat. You have to treat all the other allergens first so that the body has built up a resistance, so that when you do treat the anaphylactic allergen, your body is capable of clearing it.
I know that it's tough to be specific, but in general, when we take all of your cases in a global situation, those people coming in for this allergy elimination technique, like how many treatments would normally be necessary for something like this?
Well, that's going to depend on the severity of the allergen. Patients who are very sick, they tend to have more allergies. A not so sick person, a healthy person, may not have as many. So they're going to see anywhere between 15 and 25 allergens. Some cases, though, can have 50 or more. It depends on the individual. But allergy elimination will vary to the individuals. 80 to 100% of the patients get better.
Well, that's a terrific response to treatment. Now, does the elimination, does that need fortification of continued or maintenance to treatment or anything like that? Once a person is stable, is there a need for ongoing or, supportive care?
Well, you're not going to stop living life. So you're going to have stress, and stress is one of the main causative factors that makes the body compromised to be able to become reactive to an allergen. So we recommend that once a patient has cleared all their allergens, that they get tested periodically to see if anything relapses, so that we can retreat it before they have a reaction.
Okay, and does that then work from closer together? I'll see you in a month, and I'll see you in a couple of months. That type of thing.
Well, we normally would recommend a patient will come in at least once a season for a retest. So this way we can prepare them to have their body.
Dr. Kuchman, thank you for coming today. That was really, really informative. And Donna, as usual, I bet don't touch those needles. Thank you for assisting us today. For Natural Healthcare Alternative, I'm Dr. James R. Golding, and we'll see you next time.